Rosalente?
See.
Okay, so I'm here to explain Mohs surgery to you, and what it is it's the most. I'm sorry. It's used to treat the most common skin cancers, which you have is basal cell carcinoma, or BBC, what I'll be going by. And the main advantage of this type of surgery is that it offers precise microscopic control of the entire tumor margin while maximizing conservation of healthy tissue. So we'll try not to do too much damage to your skin, so you understand. The type of cancer being removed is BCC, like I said. How it comes is abnormal, uncontrolled growth of basal cells, which is one of the 3 main types of cells in the top layer of the skin. It usually occurs because your DNA is damaged by ultraviolet rays or the sun. You know, I know you go to the beach a lot, you live by the beach, so that could be that could be a cause. It appears as a change in skin, such as a growth or sore that won't heal. It can be open sore, red patches, pink growths, shiny bumps, or scars, or a growth with slightly elevated roll edges or a central indentation. They may ooze, crust, itch, or bleed. And there are also brown, black, or blue lesions, or white, waxy, scar-like lesions as well. Dr. Christopher W. Carr, medical doctor, is who will be performing your surgery today. He is a board-certified dermatologist specializing in medical surgical dermatology. And just to explain the procedure a little bit before we do it, and because we are doing it on your face, we want to make sure that your face is free of makeup. To prepare you for the surgery, the surgeon or the nurse will clean your face, the area that is going to be operated on. It's going to be outlined with a special pen so they know where to do the incision, and inject the area with a local anesthetic. The doctor will then remove 1 layer of skin tissue at a time, circumferentially around and deep to the clinical margins of the skin tumor. It's usually removed with a 45-degree bevel, which kind of look like scissors, to facilitate tissue processing. It is then frozen and looked under a microscope. They actually color code it so they map where it came from. And if any cancer cells are seen, the surgeon will remove another layer from skin from the exact spot on the skin where cancer cells remain. This process is repeated until no cancer cells are found. The equipment that is used is a scalpel, fine forceps, scissors, gauze, and an electrosurgical device for coagulation, which is when a liquid, especially blood, changes to a solid or semi-solid state. The local anesthesia injection is usually the most painful part of the experience, and once the area is numb, you may feel some pressure as the surgeon works, but removing the first specimen takes only a few minutes. And then tissue processing usually takes about an hour or so you may want to bring a book or magazine to pass the time. And then if more than 1 or 2 rounds are needed, the entire process can take up to several hours, so please prepare yourself for that. And because of the length of the surgery and the wound, there will be risk of scarring. We could be taking steps recommended by the surgeon will be the most single important thing you do to prevent severe scarring. If you're dealing with pain after the procedure, the doctor suggests trying a cold compress, which you can use ice in a plastic bag, frozen vegetables, or even you can get a towel wet and put it in a baggie and then freeze that for about 15 minutes. And for either one, you want to put it on the incision for about 20 minutes. How often you'll undergo follow-up skin exams depends on your diagnosis, and you should expect to have skin exams at least once or twice a year, and more often if your cancer was aggressive or is most likely to reoccur. So, Ms. Luggett, I would like to schedule a follow-up for you to come back and have your stitches removed.